What can you expect from therapy? Therapy will allow a safe place for you to explore your own life, to ask difficult questions of yourself, and to really be vulnerable. If we can be vulnerable with what we are feeling and what our needs are, therapy is a place where we can start meeting some of those. It also is a place where it's not always easy. Therapy can be quite challenging because we have certain ways of behaving to almost keep people maybe at an emotional arm's length. And a therapist will empathetically confront you with that and say, the effect that you have on me is that I feel quite distant from you. So therapy is not always an easy process, but is a process of growth and developing insight and change. Sometimes people feel worse for coming to therapy. They feel that they've embarked on a journey and they've actually opened Pandora's box and have practiced their whole life to keep this box closed. And that is a normal experience. And my experience is that we need to open that box because at the bottom of Pandora's box was hope. And as we unpack that, we don't have to carry those experiences or those feelings anymore.
So there's what I should expect from therapy, more generally what I should expect from therapy in my first session. In my first session, my therapist is probably going to ask me about what I'm coming to therapy for. You know, what brings me there? What do I want to work on? So we'd set some goals together. But also we'd probably delve a little bit into the past as well. So what was it like for you growing up? What were your relationships like? What was school like sometimes? Or we might be more in the immediate as to what's happening for you now. And let's look at what's actually keeping that going. There are also some other things that we expect from therapy from a practical point of view. In our first session, we would tend to speak about confidentiality. We would emphasize that actually what is shared in therapy is confidential. And we would also talk a little bit about if there are any circumstances in which we might have to circumvent that confidentiality. So if we were concerned about you in terms of your immediate safety and well-being or someone else that you spoke of. And that's true of every therapist in England. We'd also talk a little about framing the therapy. So how often would we meet? How long would the sessions last? Where would they be? Is there flexibility as to whether it's in person or online or a bit of both? Okay? And if there's anyone else that you need to be, linked up with, so any other clinician, which is something that we do a lot of here, linking in between also the psychiatry team. So one of the other things that you would do in therapy is draw out a formulation together. So you would map out what's happening for you, what are you clinically presenting with, where's that coming from, but most importantly, where to next? Okay, so what does a treatment plan look like? We would draw on the gold standard treatments, but also individualize it, tailor it for your needs.